Ehrlichiosis, caused by the genus Ehrlichia. Okay, this is going to be a tick, another tick-borne parasite. This one doesn't happen quite often here in the US, but when it does happen, you're going to see a patient present with what they call an acute febrile state. Okay, febrile state means mental acuity not quite there, headache, muscle spasm. Rigor means that muscles are contracting and they can't, uncontract them. It's not quite to the point of tetanus, but it's getting there. They're all tensed up. They can't untense. High fever, no hemorrhaging, no bleeding. So it's not. Remember, this is non-hemorrhagic. Um, Most patients though will recover. Okay, once this hits, their immune system clears. They're okay. Small percentage though. Um, this can have a high mortality rate. But those patients that had, this is what are they textbooks saying, about 5% of patients. Little unclear if it's 5% of all patients or just 5% of the patients that already have an underlying issue. They're older, they're, chronically ill patients means that they already have, their immune response is already depressed. Um, so those are the ones you really have to watch out for, okay? Diagnosis is a PCR test for the presence of the bacterium DNA, okay? Or you can use a fluorescent antibody test to test blood smear. Need to watch out because sometimes this ehrlichiosis is mistaken for Lyme disease, or Lyme disease is overriding, okay? Same tick that transmits Ehrlichia can transmit Borrelia, and if you're in the regions of the U.S. that are endemic for um, Lyme disease, these are two infections that can be co-transmitted. So have to watch out for that. That these symptoms symptoms for one do not mask the symptoms for the other. If PCR comes back positive and there's no sign of Lyme disease, Borrelia being present, doxycycline will help clear this up within a week or so, and the immune response will clear out everything else.